Hello everyone, I am Lindsay Sayers, and today I will be presenting to you the topic of the nurse's role in anticoagulation therapy and atrial fibrillation. I am a course-based master's student with a focus of reducing readmission rates into the hospital for patients with cardiac conditions. I have been a cardiology nurse for the last 4 years, and throughout this time I have come to really appreciate how essential it is for patients to understand the importance of medications in order to safely manage their conditions at home. This presentation will be about what we as nurses can do to ensure our patients understand the importance of anticoagulation management for atrial fibrillation. As nurses, it's important that we understand the medical conditions that our patients are being diagnosed with so that we can educate them on any new medications they are being prescribed and any potential side effects. This will allow patients to be in control of their health and hopefully help them manage their conditions at home. The outline for the presentation is as follows. What is atrial fibrillation and what are the risks involved? And what is the nurse's role in helping patients manage this condition at home? Atrial fibrillation, what is it? AFib is a heart condition that involves an irregular heart rhythm that occurs when the electrical system within the heart's atria begins to quiver and improperly transmit signals to the ventricles of the heart. Because the ventricles do not receive regular signals from the atria to contract, the pumping mechanism of the heart beats irregularly. According to the Heart and Stroke Foundation website, in 2006, AFib was the most common arrhythmia managed by emergency room physicians and accounted for approximately 1/3 of hospitalizations for cardiac rhythm disturbances. At that time, the Heart and Stroke Foundation estimated that 350,000 Canadians were living with AFib. This number doesn't seem like much when you account for the 35 million people that live in Canada, but it's important to know that the risks of developing AFib are high in Canadians. Already in the last 20 years, hospital admissions for AFib have increased by 66%. What causes atrial fibrillation? Generally speaking, abnormalities or damage to the heart structure are the primary causes for someone to develop AFib. Anyone with heart disease is at risk, so this means that anyone with hypertension, a history of myocardial infarctions, coronary artery disease, abnormal heart valves, anyone who has had heart surgery, or anyone born with congenital heart disease, those with sick sinus syndrome or other abnormalities are all at risk. Because the leading cause of hospitalizations in Canada continues to be related to heart disease and stroke, this means that a large portion of our population are already at risk to develop AFib. We also need to keep in mind that there are other factors that can cause this condition, such as hyperthyroidism, diabetes, and other metabolic imbalances, exposures to stimulants such as medications, caffeine, tobacco, alcohol, and energy drinks, lung diseases, viral infections, stress, sleep apnea, and sometimes the cause is idiopathic. What are the risks of AFib? It's important for us to educate patients about the risks involved with an irregular beating heart, as they can be life-threatening and debilitating. Having AFib gives you a 3 to 5 times greater risk for ischemic stroke. In 2010, the Heart and Stroke Foundation estimated that 20% of all strokes were caused by AFib. Also, uncontrolled AFib can lead to a weakening of the heart muscle, which can result in heart failure. According to the Canadian Cardiovascular Society, 40 to 50% of clients diagnosed with heart failure die within 5 years of diagnosis. Considering the risks, you would think that patients would understand the severity of this arrhythmia. Unfortunately, that doesn't seem to be the case. A very interesting article in the International Journal of Cardiology showed that only 49% of patients diagnosed with AFib perceived it as a serious condition or were aware that AFib predisposes them to stroke. 52% were aware that anticoagulants prevented blood clots, and only 21% were aware of the benefit of stroke prevention with the use of anticoagulants. This means that we have a lot of work to do. The nurse's role in education for the patient with a diagnosis of atrial fibrillation is vital. What can nurses do to help improve patient knowledge? Our focus should be on educating our patients about the risk involved with AFib and the importance of medical management to help reduce these risks from occurring. Many, if not most, patients will be discharged on some type of anticoagulation therapy. Patients need to be taught the side effects of these medications. If they are prescribed anticoagulants for the first time, they need to know the symptoms and signs of bleeding and stroke. We should caution them against beginning any type of herbal medication and make sure that they are aware of potential interactions with food or other medications. Patients should also be aware that before taking any over-the-counter medications, they should first check with their healthcare provider or pharmacist. Patients need to know about the importance of follow-up appointments with healthcare providers and be made aware of lab work needing to be completed as ordered, because their medication dosage may be based on those results. We have to help create supportive environments for our patients to manage AFib at home. This can include encouraging patients to use the health line to speak with a nurse or recommending them to call their physician or pharmacist with any questions, and also introducing them to any community support groups such as cardiac rehabilitation. Ensuring continuity of care between all healthcare providers is also very important for those patients returning to long-term care settings or for those who have support workers at home. Communication and coordination of care among outpatient, emergency, inpatient, subacute, and long-term care settings are vital in patients with AFib who are receiving anticoagulants to balance stroke prevention and bleeding risk. I'd like to take a bit of time to discuss what anticoagulants are used in the management of atrial fibrillation. In Canada, we do have a few options: aspirin, dabigatran, apixaban, rivaroxaban, and warfarin. It's important for the nurse to know each of the medications and understand why clinicians prescribe one medication over the other. This is the Canadian Cardiovascular Society algorithm for oral anticoagulant therapy in atrial fibrillation. This algorithm allows for clinicians to easily determine whether oral anticoagulation therapy is necessary for a patient with AFib. As you can see, it's very user-friendly. On our unit, both our cardiologist and our clinical nurse specialist use this algorithm to help determine which medication to prescribe to the patient. A patient who is diagnosed with AFib and has any of the following risk factors, so being 65 years or older, has a history of prior stroke or transient ischemic attack, has hypertension, heart failure, or diabetes, they will be recommended an oral anticoagulant. If patients with AFib have none of the risk factors above, but they do have coronary, aortic, or peripheral disease, clinicians will prescribe a baby aspirin. And if the patient has absolutely no risk factors, then no antithrombotic will be prescribed. This algorithm can help nurses educate their patients about why they are taking a certain anticoagulant and not the other. So how is it decided which anticoagulant to use? The Canadian Cardiovascular Society recommends that when anticoagulant therapy is indicated for patients with non-valvular atrial fibrillation, meaning the absence of rheumatic mitral stenosis, mechanical or bioprosthetic heart valve repair or mitral valve repair, then most patients should receive dabigatran, rivaroxaban, or apixaban. Those with valvular atrial fibrillation would be prescribed warfarin. Nursing staff should familiarize themselves with these medications so that we can educate our patients accordingly. So in review, atrial fibrillation is common within our population. This arrhythmia has serious and debilitating risks associated to improper anticoagulation therapy management. These risks can be reduced with proper patient education. Having nurses educate about anticoagulation therapy while our patients are in the hospital may help solidify patient knowledge and hopefully encourage medication adherence upon discharge. Also, ensuring a continuity of care from all healthcare providers will help create a more supportive environment for our patients at home. With patient knowledge and medication adherence in place, hopefully we will see a reduction in readmission to the hospital for atrial fibrillation. This is my reference list, but I just want to say thank you so much for all of your time, and we'll finish off with any questions that you might have.